Good evening, and welcome to one of our most anticipated events of the fall, How to Talk to Your Children About Vaccines. With the recent news of the COVID-19 vaccine being approved for children ages 5 to 11, I'm sure that many of you have questions, not only on the vaccine, but also how you can help your children feel comfortable when it's time for them to get vaccinated. Before we begin, I wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, the Mississaugas of the Credit. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. My name is Susan Drodge, and I'm the Director of Advancement at the Leslie Dan Faculty of Pharmacy. I'm thrilled to be joined by my colleague, Laura Clark, Director of Advancement from the Lawrence S. Bloomberg Faculty of Nursing, to bring you this timely and important event. This event is a collaboration between our two faculties and an illustration of the impact our expert faculty have on the health of our communities. As you know, vaccines have become an important tool in the fight against COVID-19. As vaccines become available for younger age groups, we know that parents, caregivers, guardians, and children will have questions. Our expert faculty who will be speaking to you this evening have a cumulative wealth of knowledge and experience on the subject of vaccines. It ranges from providing vaccines to children and methods for pain mitigation to being able to explain how vaccines work within our immune system and why it is important for children to be vaccinated against diseases like COVID-19. Our first speaker tonight is Jean Wilson, a nurse practitioner and assistant professor at the Lawrence S. Bloomberg Faculty of Nursing. Jean has worked on outbreak surveillance and investigations on behalf of the Public Health Agency of Canada and with the Canadian Armed Forces. She also has experience managing and understanding outbreaks that arise from animal to human transition, which has prepared her immensely for helping communities impacted by COVID-19. Wilson also developed an educational module as part of a pathophysiological and pharmacology course she teaches that discusses the types of vaccines being used to protect against COVID-19, including those that use mRNA. Our second speaker tonight is Professor Anna Taddeo of the Leslie Dan Faculty of Pharmacy. She is a recognized expert in improving pain medication, particularly in children. She has led seminal studies documenting the long-term effects of unmitigated pain in children and the effectiveness of pain-relieving interventions that are now part of routine care. In recent years, she led the development and validation of the CARD, Comfort, Ask, Relax, Distract system, a tool that incorporates evidence-based interventions in the delivery of vaccines at schools. The CARD system has been adapted to manage anxiety during the COVID-19 pandemic. Her research has also helped in the development of communication tools to help reduce vaccine hesitancy, and she's been featured in a number of media stories about vaccine side effects and strategies to mitigate them. We will also be joined this evening by Leslie Alderman, Manager of Vaccine Preventable Diseases at the Niagara Region Public Health, and Erin LeDrew, Manager of the Vaccine Clinic for the Center for Addiction and Mental Health, both of whom will provide clinical examples of the CARD system and strategies about supporting children through their vaccine experience, especially children with high levels of needle fear or children with special needs. Leslie Alderman graduated from the University of Toronto with a Master of Nursing, Health System Leadership and Administration in 2020, and has been a working nurse for over 30 years. She has experience in acute care, post-secondary education, and over 17 years in public health. As project coordinator, Leslie was actively involved in the initial pilot of the CARD system in several schools across the Niagara region. Niagara Region Public Health continues to actively promote encourage, and implement card strategies during immunization in various settings. Erin LaDrew is currently the Manager of Education at the Center for Addiction and Mental Health, and most recently led the Vaccine Clinic. Erin has been at CAMH for over 12 years, with the bulk of her time working as a clinician in the Medical Withdrawal Service Unit. Erin is also pursuing her master's in quality improvement and patient safety at the University of Toronto's Institute of Health Policy, Management, and Evaluation. It is now my pleasure to turn the event over to Jean, our first speaker.
Thank you, Susan, for that kind introduction. I really appreciate that. So I'm going to speak to you today on vaccines. So first I'm going to talk to you, First, I'm going to talk to you about the different types of vaccines. And I'm not sure why that keeps doing that. So I'm going to talk to you about the different types of vaccines that you can expect to see. And many of you are parents, so you will have experienced the different types of vaccines when your children were receiving their immunizations in childhood. And many of us as well have received these vaccines. So I'll be giving you some examples that will probably sound familiar. I'm using these routine vaccines as a jumping point to help you understand the new vaccines that are currently on the market for COVID-19. And specifically, I'm going to be focusing on the mRNA particle vaccine that is the Pfizer vaccine that's currently been approved for children between the ages of 5 and 11 years. I'm going to talk to you about the new approval and the NACI statement, or the National Advisory Committee on Immunizations, and what some of the data that has been found for this. I'm also going to talk about why it's important to vaccinate children with the COVID vaccine. So now let's get started on the different types of vaccines. So there are three main types of approaches to creating a vaccine. The first is whole organism vaccines. And this includes, when I talk about organism, it could be a virus or a bacteria. The second type of vaccine that can be created is when you take the whole organism apart into different bits, and you use those parts to trigger the immune system. Finally, the next type of technology is to take the genetic material inside the organism, and it doesn't have to be all of the genetic material, it can just be a piece. And this is the blueprint for that particular piece. So in the case of COVID, it happens to be the little pink spikes on the outside of the virus, and the mRNA is the genetic material. So now I'm going to talk about the different vaccines that you're probably familiar with. And these are vaccines that have been safe and effective and used for decades now in routine childhood vaccinations. So whole microbe or whole organism vaccines come in three different vaccines. So they could be live attenuated vaccines. And this is just the organism is still alive, but it's been weakened to a place where it can no longer create disease in the body. So an example of this might be measles, mumps, rubella, or varicella, the chickenpox vaccine. And children get this around the age of 12 or 15 months, and then also later on at the age of 4. Another example of a vaccine that's a whole vaccine is inactivated vaccines. And what this is the whole virus, but now it's killed. It's no longer alive, and it can't create any infection or symptoms in a person, and it's created into a vaccine. So an example of this might be the polio vaccine, or we see this often in some seasonal influenza vaccines. Finally, the last whole virus is one that's new to the scene with COVID, and this is the viral vector vaccine. So we're familiar with this vaccine because it's the type that AstraZeneca or Johnson & Johnson have created. This viral vector vaccine takes the whole virus for colds called the adenovirus, and it is a piggyback vaccine. So we piggyback genetic material into the cold virus or the adenovirus, and we create a vaccine from that. In that case, when the body sees the cold virus, which we've all seen before, it attacks it and releases the mRNA from the COVID vaccine into the body. The immune system recognizes that this isn't something it's seen before, and it creates antibodies and triggers the immune response now to protect us against COVID. So that's the whole virus or the whole organism vaccines. Then, as I mentioned before, sometimes we can just take apart the organism and use its different bits to trigger the immune system. So we can take parts of it, pieces, or we can use the outer coating of the organism, or we could use maybe chemicals that the organism produces. So examples of this might be pertussis, pneumococcal vaccine, meningococcal vaccine, or the diphtheria and tetanus vaccines. So finally, we're going to talk about just mRNA vaccines. An mRNA vaccine is what the Pfizer or Comirnaty, and I'm getting better at that name, and the Moderna or the Spikevax vaccines are created from. And what this is, as I mentioned before, is mRNA just specifically for the spikes on the outside. It doesn't create the whole organism, it's just the spikes on the outside, and it's that blueprint that we use for the vaccine. So here's a picture of how it works. We take the mRNA and we wrap it in what we call a lipid coat. I like to call it a raincoat, and it protects the mRNA so that it's stabilized when it gets into the body. The vaccine itself is injected into the tissues, and the cells of the human body recognize that this is a foreign particle. So it engulfs that particle and it starts to destroy it in order to trigger the immune system. Now, it's important to recognize that when it engulfs it, it doesn't go anywhere near the nucleus where we have human DNA. And so there's no way that it can impact human DNA, not in this immune process. When it's being destroyed, it starts to create proteins, and these proteins are pushed out to the outer surface of the cell, and these proteins call out to the immune system, and the immune system identifies that there's been a foreign organism in the body and starts to create antibodies to protect against it. It'll remember these spikes on the COVID vaccine or the COVID virus if it ever comes into this body again. This is called humoral or cell-mediated immune response. So let's talk about the Pfizer vaccine that's just been approved for children in 5 to 11 years. We know that it's already been approved for 12 years and up. This particular vaccine, though, for this age group, has a little bit less mRNA in it. So it has 10 micrograms of mRNA in comparison to the adult dose, which has 30 micrograms of mRNA. In the clinical trials for this age group, there were 3,000, a little over 3,000 children in this age group vaccinated, and about 1,500 that were in the placebo group. When they looked at the efficacy, which started a week after the second dose of the vaccine, they found that it's comparable to all of the other age groups, and the efficacy was 90.7%. From a safety perspective, it was also found to be safe and showed the same kind of safety profile as what we're seeing in young adults, as well as the other children's age groups. And in some cases, they had less adverse events or severity of adverse events, with the exception of maybe redness at the site and a bit of swelling. Some other common side effects that they might get is fatigue and headache, maybe a fever, but this is usually mild to moderate and quickly resolves on its own. There were no severe side effects found for myocarditis, pericarditis, or any allergic reactions. It's important to remember that the United States approved this back in October by the FDA. And so they've already started using this in this age group and have now vaccinated 2.5 million children with at least one dose of this vaccine, and are seeing the same types of safety profiles as what was reported in these clinical trials. There will be ongoing monitoring by the Public Health Agency of Canada, Health Canada, the manufacturer, and then other international regulatory bodies like the CDC, and they'll continue to share information as they get it with regards to the safety and efficacy profiles. So why should we vaccinate children if they have mild disease or no symptoms at all to COVID? Well, it's important to recognize that in the third and fourth waves, we've actually seen more children become sick with COVID. And I've provided you here with some information from the Public Health Agency of Canada on statistics specifically for children under the age of 19. And I'd encourage you to go to this website. It's extremely well done. We also know with the Delta variant that it may pose a higher risk for infection in children, although thankfully it's not showing that it's more severe disease. While severe disease is a small risk in children, thank goodness, it can happen. And I've provided some statistics here around hospitalizations, ICU admissions, and mortality, unfortunately, since the beginning of COVID to November the 19th of this year. There are also complications to infection with COVID. And MIS-C is the multi-system inflammatory syndrome that is seen in children. This is organ inflammation in children who've become infected with COVID, and this can cause significant illness and often requires hospitalization. There's also long COVID, and we're just getting information about this now, although it's less, we see it less in children compared to adults. We can see it in children regardless of the severity of their infection. And this is COVID symptoms that last for several months after the initial infection. And I've just provided an article if you're interested here. We know that there's been social and psychological impacts from the pandemic on children, parents, and families. And it's important to explain to children that when everybody gets vaccinated, it will help bring us back to normal activities that we love, such as going to school, sports activities, sleepovers, visiting grandparents, and taking family trips. So now Anna and the rest of the speakers are going to talk to you about how you can speak to your children about their vaccines.
Okay, so let me know when you can see my screen. Can people see it? Yes?
Yes.
Okay, wonderful. So I'm going to begin. Thank you very much for the opportunity to be here. I'm really excited to be sharing the stage with such a wonderful panel. So what I'm going to do is talk a little bit about trying to make this a better experience for kids. And I want people to think about the vaccination delivery now being sort of switched to a different patient population, to one where actually the needles are the biggest concern for kids, and then trying to think of why that would be important to manage and how we can help kids with that. So I want to begin by setting the stage or the context for pediatric vaccinations, just to let people know that for kids, as I said, the primary concern is needles, but not only that, but needles actually are problematic for kids. So kids are in a vulnerable age where needles can actually have bad consequences. So we do want to prevent bad experiences with needles. And this slide gives a summary of the reasons why needles are particularly problematic. So I'll just begin by saying we all know that vaccines are the most common reason people get needles. And pain is actually the most common adverse event following immunization or AFI, even though we don't acknowledge it as such. For kids, they're more bothered by needles and they report more pain than adults do for the same event or the same noxious stimulus, including vaccination. And for kids, about 2 out of 3 of them are actually afraid of needles. So the expectation is that most kids will be afraid rather than it's going to be an unusual thing. And 1/4 of adults are afraid. So what's important here is to mention that most of the time people get afraid of needles because they've had bad experiences with them, but they don't actually need to have a bad experience to become afraid. So they can become afraid just if people talk about needles in a scary way, or also if they witness other people being particularly distressed during needles. And if people are afraid, then what that can do is fuel pain. So if you're afraid, you're more afraid of the pain, you experience more pain. And pain and fear are part of a bigger group of immunization stress-related responses. And that's what we call them, that can include at the extreme fainting. And so we want to prevent those reactions from happening. And if people have these negative experiences with vaccination, what happens is they actually tend to avoid getting vaccinated in the future. And it makes sense because we all avoid things that we're kind of afraid or anxious about. So being afraid of needles is no different. And the research to date shows that about 1 in 10 people actually refuse vaccinations because of needle fear. Are my slides advancing, by the way? Because I don't see them advancing. Would someone be able to tell me?
They were not they were not in presentation view, Anna.
So they're not advancing, so which is interesting. So what I'm going to do is actually close the presentation. Thanks for telling me, Erin, and start it again and see if it works. So let's see here. So we'll try to share again. Okay, and you'll tell me, Erin, if they come out now and if I'm advancing.
Perfect. Yep,
Okay,
they look
so
great.
now is that there may not be audio on the videos. And if that's the case, then what I'll do is I'll just share the videos later after the other speakers speak. So let me just continue. So I think I was here with telling people about the problem with needles. And so the good news is we actually don't have to ignore pain or fear as barriers. You know, we can actually address them head on because we have the evidence for what can help. So we published clinical practice guidelines in 2015 that summarized the world literature on this topic. And before that, we had also been creating that evidence base. So that's been happening over the past 3 decades or so. So we have quite a lot of stuff that we can do. And what you see here across the bottom of this slide are how we categorize those interventions. We call them the 5 Ps of pain management. The first 4 Ps across the bottom left, procedural, physical, pharmacologic, and psychological, are things or groups of interventions that people can use to help with this. And then process interventions, the one on the right, is how we get everybody to do sort of the first 4 things. And I'm here to talk primarily about CARD. what CARD does is really just helps us to operationalize the guideline recommendations. So the guideline recommendations tell clinicians and patients, or parents would be included in that category, about the stuff that we can do to help with pain, fear, and fainting during immunization, but it doesn't tell us how to do that stuff. And CARD turns that information into something we can act on. So basically, CARD involves a series of steps or principles that parents, healthcare providers, institutions that deliver vaccines can use or to help set up the vaccines. And what it does is prevent those immunization stress-related responses, which in turn improves the vaccination experience. So cleverly, each letter of the word CARD also stands for a group of interventions that people can use to make their experience better. So we've basically rebranded the 4 Ps of pain management into this word called CARD. So C stands for comfort, A stands for ask questions, R stands for relax, and D stands for distract. So even just knowing these words, people intuitively have a sense of the things that they could do to help manage their fear, their pain, and anxieties around immunization. So as an example, for comfort, people can decide they want to wear a short sleeve shirt. It's actually surprising how many people show up to vaccinations not wearing a short sleeve shirt and having to disrobe, and how that can increase anxiety and fear in the moment because of that extra step, and then having to find a private space and kind of not feeling comfortable disrobing. For A, ask questions. We have worries, we have concerns, and that can make us afraid. Kids and parents are no different. Parents will have their concerns about the vaccine, possibly related to some of the safety issues or some of the data that Jean was talking about. Kids primarily will be afraid of the needle. So we can give them permission to ask questions, because sometimes they don't even want to ask questions. And if they ask those questions, they might have their concerns addressed, and that would reduce their worry or their fear about the needle. So kids might learn new things like using a topical anesthetic cream that they might want to do for their needle. R stands for relax. So people can use different techniques to relax themselves, because if they are nervous, if they are fearful, then that does increase the risk for stress-related responses. So an example of something that somebody might request is privacy, because it would make them nervous to see others getting vaccinated or to be seen by others getting vaccinated. And then D stands for distract. So some people want to be distracted, so they can bring their own devices, and we can certainly provide some things in the clinics, and some clinics do that so that people have something to do, so that they don't need to focus on the needle if that makes them nervous. So CARD is to date the only vaccination delivery framework that's been evaluated in a systematic way and demonstrated to improve attitudes about reducing fear and pain, improve knowledge about pain and fear management, improve safety of the vaccination process, and that's because it reduces immunization stress-related responses. So that includes pain, fear, fainting, dizziness, these sorts of reactions. And then because of this, improves the vaccination experience, and the vaccination experience is improved for kids as well as for the adults who are in the room as well. So on this slide, what I'm showing you is a summary of where and how parents and kids can learn about CARD and how they can use CARD. So first, on the left, going down, parents and kids can learn about the different strategies. Parents have some fact sheets for them to know how they play their cards. So everyone who's involved in the process has their own role to play. So parents have a role, kids have a role. So when parents have educated themselves, they can teach their kids, and there's all kinds of resources that are available for kids to learn about CARD and how they can play. So we have games, we have videos, fact sheets. Reminders are great, so people know and can prepare, and then can bring coping items if they want to do that. So reminders work, as we know, to improve vaccination compliance, but also with respect to CARD to help people to remember to bring the coping items that they need. So this would be particularly important for families with kids and for young kids, so the population that we're vaccinating at the moment. So on the day of vaccination, clinic spaces can be chosen that are suitable. We can separate areas before, during, and after vaccination. So especially with kids, not a great idea to have a gym-like environment where everybody can see everybody else being vaccinated and everybody's kind of waiting for their turn. That creates what we call fear contagion, where people become afraid. So trying to create private spaces for people when they're in different parts of the vaccination process. Then also individual spaces for people who are very afraid. So privacy or people who want that. Allow seating for support person, and then having a particular order. So kids who are most fearful should go first because they basically get more and more afraid over time. So you kind of want to let them go first before tackling other kids. And then interactions, being calm and attentive. So sometimes parents get nervous, sometimes immunizers get nervous, depending on what's going on. So trying to keep a calm atmosphere. So if parents know about this, then they can do this. They don't need to get nervous. They don't need to criticize their kids or try to rush their kids, but they can try to be calm, supportive, act like everything's okay, because kids are going to pick up on any stress that parents have, and kids are going to pick up on any stress also that immunizers have. So if immunizers are rushing between appointments, then that might make the whole event more stressful for the kids and the families as well. So trying to be calm, trying to support kids, invite them to use coping strategies and the coping strategies that they want. So across the bottom here of the right of the slide, you can see some of the things that kids might want to do: apply topical anesthetics, bring a support person. So usually this would be a parent, do deep breathing, and then they can have a choice of what arm they want vaccinated. So I'm almost at the end of the presentation, actually, the formal part. I just wanted to give you a sense of some of the resources that are available. So I mentioned we have some things for parents and some kids. This is the front of a fact sheet for parents. So it tells parents about how they play their cards. So what do they want to know about the vaccine? What do they want to know about the vaccination process? So to invite them to get their questions addressed so that they're more confident getting vaccinated. And then when they're confident in the vaccination process, they can invite their kids as well. So how do they prepare their kids? Same thing, give their kids information about the vaccine. So kids typically want to know why they're getting the vaccine, what's going to happen when they get the vaccine, how it's going to feel, and then how to cope with pain and fear. So importantly, though, is this part at the bottom of the slide, which says involve and listen to your child. So have the child be an active participant rather than us making all the decisions about what we should do and how we're going to do it. Invite kids to play their own cards, because kids in general are underutilized in their ability to help plan coping strategies, and they will tell you what they think can work. So we should invite them to be part of this, because by doing so, we're also teaching them how to self-regulate, how to cope with stress. And these are skills that they can use for the rest of their lives. So we have different versions of the pamphlet. I showed you one just now that's geared sort of towards teens and young adults. The one that just flipped over it is for younger kids. And then we have even a newer version for kids that are in the age range that are being vaccinated right now or planning to be vaccinated right now, between 5 and 11. And this is matching the characters on a card game app that we're going to be releasing in the next couple of weeks. So it's just matching that so kids would recognize the characters from the game. So I said a little bit about communication, sort of what to say, what not to say. Most of the time, people don't really think of vaccination as a social event, but it actually is. So people don't tend to get vaccinated on their own, right? So there's an immunizer there. And if it's a child, there's other family members, parents, possibly other siblings. So there's going to be things that other people are saying or doing that can have a good effect on the person who's being vaccinated, namely the child, or a bad effect. So there are things that people can say and do that promote coping. So we call those coping promoting behaviors, but there are also things that people can do that make kids more distressed. And we call those distress promoting behaviors. And the coping promoting ones are the ones kind of on the left side of this slide where you see the check mark about being calm and positive, telling the truth. So not misrepresenting how much the needle is going to hurt, talking in a neutral way. So don't use words that create fear or make us be afraid. So we commonly hear, for instance, on TV about getting your shot, about the bee sting. These are all words that conjure up things that make us afraid. So if we think of getting shot, we think of a gun. or something like that. So those are not really the images we want to be having kids think about. And we have to use more neutral language. And then being a coach and supporting kids when they decide what they want to do to cope. So on the right side are things not to do. So don't intensify anxiety or stress or minimize concerns. So don't, just dismiss a child's concern about pain, but actually help them to address it. And don't criticize or impose coping strategies. So probably people who have kids and have had situations where they've had procedures done can relate to sort of some of the times when things went well. And you might recognize some of the strategies now that people might have been using to help with that. And then some of the times things didn't go well, mostly on the right side. So we have also resources for parents and for immunizers to help them to know how to position kids in comfortable ways so that they feel safe, secure, and so we can still be safe as well when we're giving the vaccine. So here you see some examples of what we call comfort positions, and they're going to vary depending on the age of the child, but you get an idea here that kids are having that physical contact and comfort from their parent so they feel secure and safe, but then their parents might be holding them in a way so that it's easy for the immunizer to access the limb and to give the injection. So the positions that kids and parents would choose obviously would depend on the age of the child. So younger kids would be more supported, like the bottom left, and also more fearful kids would be more supported. And kids who are less fearful might be like the child on the right side, who's just okay to have a mom sit beside them and provide some physical comfort. So we also have, I have a couple more slides to show you about resources that would be helpful for parents, topical anesthetics. So these are the only drugs that we have to help with this procedure, but they work very well. They're almost like the best kept secret because everybody knows about them in the hospital setting, and in the community, they're not that well known. So they take away some of the sensation from the needle and make it hurt less. So these are available at a pharmacy without a prescription. They require a bit of planning to use because they take between 30 and 60 minutes to work, depending on which product you purchase. So you kind of need to know what you're doing ahead of time. I just want to say one thing about topical anesthetics is they're often referred to as numbing cream, but we need to be sure when we teach people about them that they don't actually cause 100% of sensation to go away. So people might still feel some pushing, some pressure, some sensation when they use these drugs. And that would be really important to tell a child because you wouldn't want them to be surprised if they feel anything, because you just kind of end up making them not trust you anymore because you said that it numbed the skin. And then the final pamphlet I want to show you that is also very useful in this context, particularly because kids around the preteen, teen years, that's when they have their first episode of fainting, and young children, well, young teens, I would say, teens and young adults actually have the highest prevalence rate of fainting with vaccination compared to any other age group. So this would be an important thing to teach people to do. There's actually a very simple technique to prevent people from fainting. So usually we kind of ask people if they've ever fainted, but then we don't really do anything with that information. We just sort of think to ourselves, okay, we have to be prepared just in case this person faints, but we can actually prevent that from happening. And really all we have to do is teach people to tense large muscle groups before they start to feel faint, and to do this rhythmically during the procedure and then after. And that just involves kind of pushing down on the floor with your feet or pressing your knees together. And that can prevent a drop in blood pressure that happens when people faint. So there's lots of great feedback we got from our research with CARD. I just want to highlight one of the things that nurses have told us, but heard the same thing from parents, from teachers in the school, that CARD really is teaching kids about coping. So it's not just about pain or fear of vaccination, it's actually useful for anxiety in general. And in the current COVID pandemic context where everyone's anxiety is higher than normally, we don't want to be adding more to this. So we want kids to be prepared and confident, and they can use these skills in managing other stresses in their life. So we're amassing all of these tools and resources on different websites. They all kind of point at each other. but they're housed through the Hospital for Sick Children via About Kids Health, which is their information sharing website for geared to parents and families. And we have QR codes here that people can use to access the suite of information that's available. So I've come to the end, and hopeful that you got some ideas about what CARD is about and maybe how you can use it for your kids' vaccinations, or if you're a clinician, how you can try to make the environment and the interaction more positive for kids and for their families. And I think I'm actually just going to stop here. There's some references, like with Jean, I've provided some information in case people are interested, and I might close the presentation and come back to the videos if that's okay with everyone. And just let Erin and Leslie also have a chance to speak. So thanks everyone for your attention. So what I'm going to do is turn it over to Leslie. And Leslie, I want to maybe just preface by saying you at Niagara Region would have the most accumulated knowledge and experience with CARD compared to anyone else, because CARD was developed there. So I wonder if you can help people to understand what that took, you know, and how you implemented it, and then sort of what's the ongoing feedback you get from it. And then maybe, you know, people who might be listening would be concerned about whether CARD is not going to be offered in a place where they might get their kids vaccinated. So what are the things that you think that they should do, or how should they prepare in case there is an environment where they go and kind of CARD's not there? So I'll let you screen share now.
Hey, thanks, Anna. Let me just pull up my. Okay, can everyone see my screen? Perfect. Okay, hi everyone. As Anna mentioned, I'm going to talk a little bit about how we promote and support the use of CARD in various clinic settings here in Niagara Region. As part of a pilot project back in the 2017-2018 school year, we implemented the CARD system in a small group of schools within the Niagara Region. We found that the CARD strategies aligned well with many of our current practices. Namely, it's a client-centered approach. It ensures that choices are offered to students. It gives students control over their vaccination experience, and it promotes students to be actively involved, engaged, and informed in the vaccine experience, when this is often the first time they're receiving vaccine independently. The nurse found that CARD was instinctively intuitive in nature and gave a foundation that was consistent and supported by all the parties involved in the grade 7 school-based vaccine experience. So CARD was systematically integrated into our service delivery model. We started by looking at the current processes that were in place to include the CARD system wherever possible. So this included updates to our internal policies and procedures and our best practice approaches to immunization. We had to make sure that all parties were engaged and educated on the CARD system. So this meant ensuring that students and school staff were taught about and familiar with CARD ahead of the school clinic day. Parents were provided information on CARD so they could support their children on the use of CARD during immunization in a calm and reassuring manner. Nurses from both the vaccine team and the school health team were taught about CARD, and all those involved in the school campaign had defined roles and responsibilities on clinic day. We also had to ensure that we were holding the clinics in the right spaces and places. So we wanted to make sure that the places were safe, that it decreased chaos, allowed for proper flow, and it gave options for privacy, as Anna had previously mentioned. So we had, a separate room in most places for privacy for children that wanted that. Or sometimes we would just use a bookshelf as a partition, or if there's a partial wall available, we would use something like that. And we made sure that we set up the injection stations in such a way that the students would not be watching other students receiving their vaccines, while also maintaining pre and post-vaccine areas separate from the injection area. So related to CARD, the following strategies were employed. So we made sure that the students had a support person present if they wanted one. Almost every single student used some sort of distractions tool, whether that was a phone or an iPod or an iPad, bubbles, fidget spinner. We had pipe cleaners if they brought in their own distraction tool. So every student pretty much used some sort of distraction method. We did a lot of teaching about deep belly breathing, and some students did use this strategy as well. We encouraged time for the input during the meeting with the nurse to encourage dialogue and to answer any questions that the students may have had. We assessed each student's level of fear and we planned their care accordingly. We provided privacy, as I previously mentioned, if they requested it, and we received feedback and evaluation back from the students as well. So each student, they did provide this feedback on what card they wanted to play at the time of immunization, and the nurse was then able, excuse me, to plan an immunization experience that was unique to them. Most frequently, students chose to use a distraction tool, as I had said, during immunization. Cell phones were, of course, the most popular, and bubbles were the most common when a support person was present. This is just an example of the various distraction tools we used during our pilot, along with the card divider that could be used as a barrier when drawing up the vaccine to prevent it from line of sight. And it could also be used as a trigger to prompt discussion about card during the whole immunization process. After the pilot, Niagara Region Public Health has continued to encourage, support, and implement card into service delivery. This includes introducing the use of card to all schools within our region, embedding card in the way we plan and operationalize clinics, and using every opportunity to gain feedback on the vaccination experience. As part of our school-based campaign, we educate students on card ahead of clinic day, letting them know what to expect on clinic day. We have a PowerPoint presentation. We show them an example setup. We play them some videos about the card system so that they're well prepared. We also have an infographic that we send home to parents or caregivers. And part of the infographic does speak to preparing your child for school vaccinations. So it does highlight the card system and encourages parents to talk to their child about the immunization experience. With continued promotion and implementation, card becomes second nature really for all of our providers here at Niagara Region. And the more people who hear about card and use card, the better the vaccination experience. All public health nurses at Niagara Region are trained on using card strategies. We adapt our resources based on the clinic setting. We accommodate for card in the various clinics that we're holding. An example would be setting up privacy spaces in mass immunization clinics by using movable whiteboards or screening or partitioning off pieces of the clinic space to allow a private area. And we have card resources available at every clinic as well. The picture shown here is from a clinic we did last week, a mass immunization clinic, and you'll see that every injection station still has a prompt about the card resource available for the nurse and the client to promote discussion. As parents, there's lots of resources available online, as Anna had mentioned about card. This is an example from our Niagara Region website in our FAQ section to do with child and youth COVID-19 vaccination. So parents can access and review card resources through this site. It goes through asking about what the card system is. It redirects them to those sites that Anna was previously speaking to. Talks about helping your child using card during vaccination, and even how to use card to cope with any type of stressful situation. It's important to note, and as Anna had mentioned, that during our pilot and during our school clinics, we still try to accommodate and immunize the children who are most nervous first, rather than having them wait and become more nervous about the vaccinations. So to bring it all together, we learned that CARD needs to be systematically implemented. This includes, keeping children, youth, and parents informed, engaging school staff to share consistent messaging, and educating local healthcare professionals on the use of CARD. Last week, we held a town hall for primary care providers, and during that town hall, area healthcare providers were encouraged to look at the CARD resources and implement it in their practice site as well. So that wraps up my part of the presentation, and I want to thank everyone for their time and sending it back your way, Anna.
Thank you. That was great. Thanks, Leslie. I appreciate that. I want to call Jean back on. Jean, I'm just curious, we talked about different people playing their cards, and I want to hear more about, the parent playing their cards and their asked cards. So, parents are going to have some worries about this vaccination. We've heard about this. We've heard that, 50% of parents are on board, but others have questions, not so keen. So can you tell us what kinds of questions are the most common ones and how are you addressing them with parents?
Sure. So I find that parents have a lot of questions, and I find that, some of the questions specifically around COVID have to do with their safety and their safety profile in coming to market so quickly. And I find that as healthcare providers, it's incredibly important to actually understand how vaccines are created and how the Canadian regulatory bodies take care to be robust and comprehensive in the way that they review the data associated with all of the vaccines that are used in Canada, but specifically the COVID vaccines. So while yes, because of the pandemic, these vaccines have been expedited just so that we can get them and get back to normal. I talked to parents about the fact that all of the checks and balances with regards to safety and efficacy with the data goes to Health Canada first, and they do a robust review of all the data from the manufacturers. Then when they have approved that, the data is then reviewed a second time by experts at the Public Health Agency. And when they've reviewed the data, then they present it to this independent group, which is the National Advisory Committee for Immunizations. And and then they make statements to help healthcare providers understand the data and to implement it. And I think just understanding that those checks and balances, all of them are still in place, I think helps parents understand that the vaccines are safe and effective, and that even though a lot of the data is still rolling in, that there's some pretty major vigilance going on for these organizations and for the manufacturers to be on it, and that they're sharing information internationally and globally now, as all of the countries are implementing these vaccines. So there's large numbers being vaccinated and all of that information is being shared. So I think that is incredibly reassuring.
Yeah, so that's great. Thanks for that. And, as a pediatric pharmacist, I can say that most of the drugs that we're using in pediatrics are not studied as well as the vaccines have already been studied, right? So they're also got to keep that in mind. We're going to accumulate a lot more information with the vaccines than we have on most of the drugs, but if not all the drugs that we're using in pediatrics combined, right? So that's great. So I'm going to actually let Erin share her screen now and tell us about what's happening at CAMH. So you've led some vaccine clinics in the hospital setting, Erin, and specifically at CAMH. So there's going to be some stuff that you can share about why you decided to do this and just how this is helping or how your population might be different.
Thank you, Anna. And give me 1 second here. I'm going to make sure I'm sharing my screen in the proper mode here. Sorry, all. There we go. Okay, thank you. Yes, well, so at CAMH, we have been running our vaccine clinic, the COVID vaccine clinic, since January of this year, and we've had many lessons learned. And early on, as we tried to reach many of our unique populations here at CAMH, including our adult neurodevelopmental service, we started to realize the importance of reaching those who had some very real fears and phobias, or just even anxiety around needles and vaccine. And so we started to look to approaches that we could use to change our clinic. And really, it started with information, environment, and people. So much like, we've been hearing, like Leslie said, it was having information available to people right when they got to the clinic. And then we started to try our best to reach people before they came to the clinic, especially if we knew that they already had some fears. And then we looked at our environment in the clinic itself. What could we change? What did we have control over to try to improve the environment and make it a little bit more calming and relaxed? And then the people, it was really training some of our staff also in CARD, using lots of different signage to make sure that that was clear, and then training the staff really in that approach. So like I said, we had a lot of really great lessons learned. And, the first one started with our appointment timeframes. So at our clinic in particular, when we were using CARD with an adult population, I guess because really at the time, they were the only ones approved for the vaccine, we realized that it was really important to offer sort of an appointment window and offer a little bit more time. So this is something that we will continue to do as we reach the younger age group, because it just allows for a little bit more time and consideration, and allows for that relaxation and calm environment. We did start to offer a lot of checklists and surveys to just hear about how it was going, but also to give people choice in terms of their accommodations. So Anna, your presentation touched on the distraction. There were a lot of different options that we thought we could offer, and our checklist gave the patients at the door sort of a choice in what they felt might be most helpful for them, and setting the expectations right from the beginning. So the more that we were able to get the CARD information out there in advance to people, or in advance of their appointment, the more helpful we knew it was. And then getting sort of everything in place, and the message out there was really important, and took a lot of support from our public affairs and other departments here to really make sure that people who maybe had some more extreme cases of needle fears and anxieties knew that there was somewhere to go to have a dignified experience of their vaccine. And I'll tell you that some of the data that we have received from the surveys, and for sure this should be no surprise based on the other presentations too, that over 70% of those surveys identified having a privacy booth and not seeing the needle were their preferred accommodations. And over 60% of those surveys identified that CARD helped to a moderate or great extent. So having that information in advance really did improve their vaccine experience. And so for those of you who might be working in clinics or primary care, or have other opportunities to look to adapt your environment and support those that are coming to you with young ones, I really encourage you to look at your physical space, the flow of the clinic, having lots of signage and being as clear as possible, controlling the elements that you can, reducing overhead lights, reducing volume of people in your clinic, noise, and other visual triggers. In some of our more highly specialized clinics, when we had our adult neurodevelopmental service in, we removed actually all sort of medical equipment from any visual site, even sharps containers. It made a big difference for a lot of those folks. And so I would encourage you to consider if that's something that you could maybe even do in your clinic as well. And then having lots of other resources. There's been many shared even in this presentation, but, bring those with you where you can and advocate, for your own accommodations that you feel like you might need. This is just, again, to say that this was the material that we were so fortunate to have from Anna, and having posters, checklists, surveys, and information there was really helpful in our clinic throughout. I thought I'd offer a couple of visuals just so that people could also see a little bit about what our clinic also looks like and some of the real life adaptations that we've done. So here's an example of some of the privacy booths, and you can see we're already getting ready for kids with some of our images in there. You'll see that we also have some gym mats that are just to the side. Now, this was a really quick and easy way, because we already had the gym mats, to allow for choice in laying down. So I know that Anna showed some wonderful suggestions on comfort positions, and I encourage you to consider those, but also consider lying down. Sometimes lying down can also really help improve those stress responses, especially fainting and dizziness. And you don't always need a stretcher or big cots or any other big space. It can be just the use of a couple of these gym mats piled on each other that can really do the trick. Here are some other examples and some other adaptations we did for our privacy booths that really helped communicate when they were available and when they were clean, ready for the next patient. And that is all. I think I caught us up on time too. Thank you.
Yeah, that was great. Thanks, Erin. So maybe I want to just get some final words from everyone. So we've heard a lot about sort of some of the considerations for vaccinating kids, some of the accommodations, approaches, the kinds of questions you're going to get. I wonder if, and how all of you have played your cards, right, to try to help make it a better experience for everyone. I wonder if you have a final thought that you want to share with everyone, a takeaway. It could be something just reiterating something you think is important, or something new that you didn't have a chance to talk about. So maybe I'll start with you, Leslie.
Sure. Thanks, Anna. I think one of the biggest takeaways, and I think I mentioned this during the presentation piece, was just, the more we use it, the more we talk about it, the more comfortable we are, the more it becomes second nature. Even when we're planning all of our clinics, even, staff that are new to Niagara region, it just gets talked about. Like it just becomes forefront to what we're thinking. Like, how are we going to, get the card information out there? Or for instance, with the 5 to 11-year-old clinics being recently announced, it's like, how can we get messaging to card out there? It just becomes part of what we think and do as part of our immunization services.
That's great. Thanks. Jean, some final thoughts from you?
Thanks, Anna. So I think it's twofold. One is for the healthcare providers who provide vaccinations. Highly encouraged to be extremely knowledgeable on all aspects of vaccine, all the way from the development and the different mechanism of action for each one of the vaccines in early childhood, as well as specifically with these new platforms for COVID. And by being that knowledgeable, it makes being able to explain to parents who have questions much easier. And then for the parents, I would highly encourage you to look at the A and engage your healthcare providers in asking as many questions as you have. Anything that comes up for you that you may see on the internet, that may be misinformation, that doesn't seem quite right, to honestly write those down and bring those questions into your healthcare provider to give them the opportunity to answer everything that you want to know in order for you to make an informed decision and be comfortable with the decision that you're making for your children, because we know that that's important.
Thanks very much, Jean. And Erin?
I think I just would like to say to those, in the audience that are working in the field that, as a clinic that started in new territory here for us, we were quick to learn about just how useful CARD could be in our clinics. And we saw tremendous success even with adults. And I know that there will be the same for kids. And so for anybody who's just looking for ways to make the environment a little bit more friendly, know that there are many, many options when you turn to the CARD system. And it's easy to do some of these adaptations, and they make a world of a difference for the patients.
Thanks, Erin. So I'm being told we don't have a lot of time, so we're going to go to questions. And if there's time at the end, we'll show the videos that I didn't show before. Otherwise, they will be made available to everyone. So don't worry if we don't get a chance to play them now. So I'm going to let you take over, Laura.
Thanks very much, Anna. And thank you to everyone else, all of our speakers, for that really engaging discussion. Really appreciate it. My name is Laura Clark, and I'm the Director of Advancement at the Lawrence S. Bloomberg Faculty of Nursing. I'm going to take a few questions from the audience now. We did receive a few questions in advance that we will ask, but if you have any questions that have come up, please put them into the YouTube chat, or you can email them to alumni.pharmacy@utoronto.ca. We'll try our best to get to as many questions as we can. And for those that we miss, you can send us an email after the event as well. So the first question I'm going to send to Leslie and Anna. Do you suggest the child, if they are comfortable, communicate their own comfort and distraction strategies to the clinician? As a parent, I want to encourage this, but I'm also concerned my child will not be taken seriously.
Okay, so I'll take a shot, not use that word. I'll take a first go at it. And I would say absolutely, parents should invite their kids. It's a great thing to do. Get them to participate in their healthcare, get them to start thinking about these things and advocate for them. And then they can advocate for themselves, and you can support them in their choices. So if they ask for these things with the clinician, you can be there to say, yeah, we talked about these things, and that's what Joe or that's what Mary wants to do, and I'm happy to support them. So modeling that for them is also a great way to get them to feel comfortable to do it. There will be occasions, I agree, that where things won't go as smoothly as you would like them to go. But if you feel confident and you feel like you know enough, to Jean's point, you kind of prepared yourself, you can be able to handle those situations much more positively than if you're kind of not prepared at all. So the more you prepare yourself, the better, and prepare your kids, the better you'll be able to handle these situations, and especially the stuff that's not in your control. So that's the great thing about preparation. It's kind of like going into a test or doing something or going somewhere for the first time. You know, if you kind of know what to expect, that's kind of within your control, then you should sort of do what you can. So I don't know, Leslie, if you want to add on to that.
No, I think the only thing that I would add, Anna, is, coming prepared as well with, distractions and different strategies already that you've discussed with your child and things that they might want. So, if they wanted to bring their iPad that had something on it, just coming prepared, and having that ready at the clinic when you're there would probably be, good to have around with you.
That's great. Thank you both so much. Second question, just looking at it here. So Jean, you did talk about this a little bit, but we have a question. What are some strategies to sell the idea of getting kids vaccinated to parents? What language is best to use and what points to focus on? As you mentioned, kids aren't as at risk for severe illness as adults are, but this person says their sense is that many parents will be hesitant to get their kids vaccinated. So how can we talk about this a little bit more compelling way to get parents on board? Do you have anything else to add on that?
Yeah, no, it's a great question, actually. And one of the reasons why I put up that slide. So I think, I think it's important. Parents want to make the best decision possible for their children, and they're responsible for that. So I think starting out from that lens and just respecting the fact that there may be hesitancy there may be a lot of questions there. I think that opens the door to the dialogue in the first place. Encouraging the vaccination by talking about some of the different things that we've talked about, I think is important. I think it's important for parents to know that while it's oftentimes there's asymptomatic and mild illness, there still is the risk for more illness and potentially the consequences, and we don't know what that looks like for children. And it's also, just understanding all of the safety profiles that are involved with this. I mean, children get vaccinations. That's why I was talking about all of the childhood ones that most of the parents are keen to get for their children. And so it's just looking at those vaccines and then talking about the COVID in a similar way, so that they can understand. I mean, we don't see things like polio anymore, thank goodness, but there's a reason for that. And so it's just sort of trying to use what we know already as a way to try to explain to parents. And I find, for the most part, if I just approach the subject and ask whatever they're concerned about, it doesn't take long before people will engage and go ahead.
Yeah, so to add on to what Jean's saying, if parents are confident, then their kids will be confident too. And then, people are going to talk about their own circumstances. So if it does make a difference to whether your child is able to participate in certain school activities, or if it's the difference between getting regularly tested to make sure you don't have the disease, which in and of itself is not a very comfortable process either, by the way. And would distress children. So it's finding those things to talk about so that kids can relate to the reasons you might be wanting to do it or not. And there is a risk, as you said, Jean, right? So we don't know who's going to get sick, but some kids do get sick and some kids get long COVID and they're not necessarily even sick. So, these are kinds of all risks, right? And so far from what we know, the vaccine doesn't have risks, like these measurable risks like the disease does. So these are important things to communicate, and to communicate them clearly, simply, but in a way that's very transparent for kids.
Thank you so much to both of you. That's great. One more quick question and then we'll wrap it up. Erin, we have a question. Can anyone access your clinic at CAMH, or is it geared to a specific audience?
No, we are open for anyone and everyone. We have appointments that you can book online. And if you do require some additional accommodations online, we do have instructions that you can follow to make sure that those accommodations are clear. But no, we have our doors open for everyone.
That's wonderful. Thank you so much.
Thanks.
Thank you, everyone in the audience, for your questions. This just about wraps up our event. I hope that you will leave tonight feeling a little more informed and more comfortable in your decision around vaccination for your children. I would once again like to thank all of our speakers for taking the time to provide us with these really helpful strategies to not only talk to our children about the COVID-19 vaccine, but also some great ways to help them feel comfortable and confident when they're going through their routine vaccinations as well. Following this event tonight, we will send all attendees an email with links to the recorded version of the event, as well as sharing all the resources today, including the videos that we couldn't get to. We will make sure everyone gets some links to those. And we will also send out a survey, so we hope you'll provide us with some feedback on the event tonight. Thank you so much to everyone for joining us, and enjoy the rest of your evening.